Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are excited to welcome back to the show Dr. Filomena Trindadi, a physician, teacher, author, and international speaker who focuses on functional medicine and a holistic preventative approach to health. A graduate of the Fellowship in Anti Aging Regenerative and Functional Medicine, Dr. Trindadi has long served as an ABOIM faculty member. Welcome and thank you so much for being with us today, Dr. Trindadi.
Oh, thank you. It's my pleasure.
You have been practicing and teaching on bioidentical hormone replacement therapy for some time now. How has practicing this therapeutic option evolved since when you first began?
Wow, that's a really good question. I think the way it has evolved is our research has evolved. We've learned a lot. We know that it's all about transdermals. Even in the very beginning, we knew that, but we now have more literature to support that. And I think that we've also had sort of a lot more support for what we do research-wise and science-wise. And I still find, though, that there's a lot of miscommunication. There's still a lot of patients that think that if they go on hormone replacement therapy or even hormone balancing, because you can sometimes balance hormones without using hormones, that you are still affecting their or increasing their cancer risk, which in many cases you're actually decreasing. So there's still a lot of patient communication, I feel. But what I've seen is that throughout the years, patients have become a lot more savvy. They're well-researched, they're sort of well-educated, or they've educated themselves as much as they can, and so they come in having a little bit of a fund of knowledge, and in most cases a pretty good fund of knowledge. Sometimes there's still some nuances and some miscommunication, but I find that over the years, it's been, almost 20 years now, that it's gotten a little bit easier, a little frustrating on some aspects too, because we still have many of our colleagues that don't understand the difference between a progestin and progesterone, and still have to deal with that on a daily basis. But overall, I'd have to say that we've had this emerging literature about hormones and hormone metabolism, and that has really, in a sense, revolutionized my practice, because I'm able to educate patients and I'm able to work towards really decreasing the risk, which is really where it's at for me.
You have spoken on the profound impact cultural understanding and sensitivity can have on patient care. Do you have any advice on how clinicians can better integrate cultural understanding into their care approach?
Well, I think in general, just being aware, right? We still have some colleagues, unfortunately, people in general that sort of practice by just looking ahead and not really seeing the whole picture. You have to do that when you're looking for the root causes of disease, and you have to do that in life in general. So I think that in general, just being aware that people come from different backgrounds, they've had different experiences. Some of those have been pretty traumatic, especially if they've experienced racism or sexism, or even just, ethnic bias, that if you even just take that into consideration and you mention that with patients, it will make, a whole big difference, because it's all about being culturally aware. You may not know what it's like to be from that culture, but if you can at least mention or say that you realize that there are some nuances, there are some differences, and you're open-minded and you want to learn more about it, I think that makes all the differences in the world.
We are very excited to have you speak at the upcoming ABOIM World Congress during a session on healthcare disparities. Will you provide us with a preview of your presentation?
I'm really excited about this presentation, because I think in general, and this is from some of my mentees, some of my fellow docs, and even some of the people that I meet at conferences, there's this general belief that this type of medicine, whether you call it metabolic medicine or functional medicine, integrative medicine, what I call root cause and good medicine, that it takes a lot of money, and that you have to be rich to be able to receive that type of care. And my background is in the nonprofit arena, and that has been what I really tried to implement. So I still have many patients from the nonprofit days that have followed me, and that many of them I see pro bono, or I see at a very discounted rate. And I am able to provide care for them because there's many different sort of tools that we have that can help us do this without necessarily spending a lot of money. Now, it doesn't mean that some laboratory evaluations, for example, aren't costly, as some of them are, but in general, there's exceptions. There are companies that will do a sliding fee scale, or they will match whatever discount you give to a patient. And there's also many different tools that we can incorporate so that this becomes good medicine that's medicine for everyone.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders, and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show. And final question, how are you prioritizing your health and well-being these days? Are there any particular wellness habits you practice regularly?
Well, there are some habits that I practice regularly, and there are some that I especially practice, after COVID. I think with the COVID scare, it has really helped me emphasize how important taking care of my immune system is. Up until this point, I've always sort of struggled with keeping my cortisol levels down and making sure that I'm doing enough to increase my heart rate variability and to eating well, sleeping, all those things that are those modifiable risk factors that are so important. And sometimes, we struggle because we have deadlines, we're like being busy, we're multitasking all the time. And of course, we need to measure the offsets of stress on our body because we're all faced with stressful situations. And I feel like the really important thing is to see how are we responding? How resilient are we? How resilient is our HPA axis, for instance? And with COVID and seeing the fear that it instilled in so many people, even so many people that I sort of look up to that may not have really followed the science, but went along with this scare and not really thinking for themselves or applying all the knowledge that we have, it has made me sort of take a step back and see, what do I do with this? And how do I sort of not let this craziness really affect me and my way in the world and me being in my own body and living in my own body. So I've become much more aggressive, not just with diet, because I've always been pretty aggressive with diet and growing my own vegetables, but since I'm spending more time in my island, I'm able to do that more. But the other thing is to incorporate more things that really help lower the effects of stress on my body. I've always done yoga and bar, Pilates, and I continue to do that. But now I actually started teaching a class because I wanted a class that incorporated a little bit of each of those for my patients. So I ended up teaching one. But the other thing is to do more varied things. So I learned about brain spotting, and I'm incorporating it in my practice with patients, but also in practice with myself. And that is, brain spotting is really looking at the areas of the midbrain where we have stored trauma, and then figuring out how do we release that trauma, because we have to pretty much reach into the midbrain and then be able to release it physically. And brain spotting uses your gaze to do that. So I've been doing a lot more of that, and meditating and just spending time in nature, finding awe in nature, and doing more of the things that bring me an aha. I used to talk to patients about, what's your aha? Do you have something that you do every day that gives you an aha? Now I'm really focusing more on walking the talk. I feel like I've always done it to some degree, but I'm doing it to a whole different degree now. And it is sort of this big epidemic that has made me really focus on that and realize just your state of mind, how much that impacts how you can react to a virus and what your immune system can do. One other thing that I've really been doing, and especially in these COVID times, is really focusing on my spiritual practice and sort of evolving, as a spiritual being. I've always had a spiritual practice. It's always been part of who I am. But with COVID, I found it even more important to work on. Although I've always been working on it, I just felt called to do that because I was missing so much of that one-on-one contact with people. And seeing my patients, on the screen and not really being able to hug them or touch them or really witness how they felt. You can only do so much through video, that I really went within and started doing more meditation and really focusing on my sort of evolution as a spiritual being. And I found that to be crucial, not just for lowering my cortisol and staying healthy, but also for reaching out to my patients and talking about that, because some of them were feeling so isolated. And that, to me, in many cases, just made all the difference in the world. And it was a really good way that we could connect without necessarily being present, but really focusing more on our evolutions as spiritual beings. And I also set up a group where I was doing that with a few of my friends, and we were reading different books and deciding how we were going to implement that in our lives and how we were going to sort of help each other grow. And that has just been priceless.
Well, thank you so much, Dr. Trindadi, for spending your time and your expertise with us today. We truly appreciate you.
Oh, I appreciate you, and thank you so much for the opportunity.
And thank you to all of our listeners. Until next time.